Weight loss drugs may help with liver disease, and we want to get into this more, so we're going to bring in an expert, Dr. Diane Hess, to explain. Dr. Hess, thank you so much for joining us this morning.
Thank you for having me.
So take us inside of the study and the results and which drug specifically it refers to.
Sure. So this study was paid for by Novo Nordisk, the makers of Wegovy and Ozempic. And this study was testing about almost 1,200 patients to see if Wegovy or Ozempic, which are semaglutide, will help metabolic dysfunction associated hepatitis, which used to be called non-alcoholic fatty liver disease, but we took the word fatty out and it made it sound more medical. But this disease is really what happens when you are overweight or obese. The fat actually infiltrates the liver and the liver cells, and it makes the cells swell with fat lobules, and it creates this inflammatory state in the liver, which ultimately leads to fibrosis, scarring, and then cirrhosis. So up until now, we only had one drug that would treat this illness, and it wasn't very effective. So this study was quite amazing because within 72 weeks, about 2/3 of the patients, their steatohepatitis, this inflammation of the liver with fat, resolved. I mean, completely resolved. And in 1/3 of the patients, the fibrosis disappeared. And this is unheard of. So we've never had anything that reduced fibrosis in the liver. So this is very exciting, and hopefully this will get approved to treat this illness.
Yeah, and they saw that change in less than a year and a half, from what I'm hearing,
Yes,
for the people who are using
exactly.
those drugs. What do you think, doctor, this could mean even in terms of insurance clearance for more people to take the drug for that reason when it comes to liver disease?
I think that this will be approved quite quickly because the study has been so successful, and it will help enormously for insurance companies. And I just have to tell you something. When I read this study, was that nobody talked about the physical exam. They talked about scanning the liver, they talked about blood tests, but really, when you examine a liver, I'm a clinician, you can actually feel the liver is enlarged below the ribs. And that's the first way that you diagnose this.
Wow,
the cheapest way.
That is just incredible.
You need the test to make it official.
Yeah, so for people who are on the drugs and say they don't have any issues with their liver now, could this, ward off potential risk factors in the future? What's the message here?
Yes, absolutely. So we know any weight loss is going to help prevent liver disease from this, not from alcohol, of course, but liver disease from being overweight or obese. The problem is this is a silent disease. So you don't really feel like your liver's enlarged. You don't feel pain. Usually your doctor is running a panel because we know that this is associated with obesity. So we send for liver function tests. Or if you pick it up on exam and you feel that it's large, you send that patient for a scan. So this is quite silent. And then all of a sudden patients find out that they have this, impressive liver scarring or liver fibrosis, and it could kill you.
Wow. Well, this is definitely a groundbreaking study with these findings here. Thank you so much, Dr. Diane Hess, and I'm sure you're encouraging people to talk to their primary healthcare providers to learn more. We appreciate your time.